Hello. So before we introduce ourselves, I would like to acknowledge the traditional owners of the land that we are meeting on today, and we pay our respects to the elders that are past and those still present. Sorry. My name is Trish Deves and I work at Wominda, an Aboriginal women's health organisation in Nowra on the south coast. And we are working in partnership together from some funding from the Institute of Cancer New South Wales with Amy. So what this project is to provide culturally appropriate video and resources for the Shoalhaven community, and just so that the broader community also know what the centre provides, and that it's not a scary place as well, and just make it culturally appropriate. So this is just some images of the Shoalhaven region and what the Shoalhaven also covers. So it's from Moss Vale, Kangaroo Valley, all the way down to the south coast. And this is just myself and a colleague just gathering some oysters, which we would like to do down the coast. Okay. So the project aim is to strengthen the capacity of local services and community structures to support members of the Shoalhaven and Aboriginal community with cancer. So partnership between Wominda, where I work at, and the Illawarra Shoalhaven Local Health District Cancer Services, and like I also thanked as well the Cancer Institute New South Wales grant project. So these just are our 5 key deliverables for the project. We've just got a journal that will be for the Shoalhaven cancer care patients, men as well as women, to use. We've also just developed a video that hopefully we get it by next week. So the next conference that we attend to, we hope to share it then. So the first one is the video and also the culturally appropriate cancer journal. So it's for patients to take to each appointment as well as the cancer centre for their notes, appointments, journal, just some empty pages if they want to do some drawing or scribbling. And also 2 cancer support hubs. So these will be at the local AMS, Aboriginal Medical Service, and Wominda as well. So about all broad cancer information that surrounds the community. And the data, which Amy will cover at the end of the project. Alright. So firstly, I'd like to just acknowledge my uncle Paul Scott. So he's an Aboriginal elder from Nowra in the south coast of New South Wales. So this is we decided, okay, let's get some local artwork for the journal and the resources, the launch flyer, any of our resources we create really. So we decided to do an expression of interest for people to, local Aboriginal men and women, to deliver previous artwork that they've done and add the stories as well. And then the artwork was then decided who was going to do the art from local, an elders committee that is at Kulingati and an Aboriginal Health and Education Service in Nowra. So what happened was elders had selected Uncle Paul, and we gave him dot points just of description of what we're wanting to cover in this project and our aims. He's also had a lot of family as well with cancer, so it was really meaningful for him. So in this story, and it will be on the Wominda's website as well for the full story of the artwork. So the dark blue represents the Shoalhaven River. And down the bottom you can see the cancer cells, and as you go up it's then the T cells fighting the cancer cells within the yellow. The circle is the daffodil, and that represents the Shoalhaven Cancer Care Centre, and as they go up that's just a field of daffodils, which is either palliative care home stretch, and you can also see this Aboriginal symbols of spirits that have sadly passed on. So it's a really amazing artwork it is, and it's got a really deep story behind it. So again, this is Uncle Paul, and this is also just our reference group as well. So whatever we do within the project, we take it out to a reference group. So there's one person from about 5 or 6 different local communities, so Aboriginal and non-Aboriginal communities as well. We get a lot of feedback from them and opinions and thoughts to make sure we're also doing the right thing for community and we're not just seeing it from one eye. So this is also our video that we're doing. So the purpose is cancer treatment journey for Aboriginal and Torres Strait Islander community members, to promote the Cancer Care Centre as a welcoming and supportive place and increase the confidence in the community, encouraging people to access treatment and support. So this is just a little bit of photos, as we don't have the video at the moment while we're doing our filming. So we've got about 4 really well-known Aboriginal locals in the video. 2 of them are also undergoing cancer treatment at the moment. So it's going to be a very heart-touching video. It is for a lot of the community about, your diagnosis. Make sure you tell family, make sure you get your treatments done, and that the cancer centre, it's local and it hasn't been there for a long time either, the Shillelagh Centre. So a lot of families have had to go up to Wollongong and to travel a lot. So just to, make sure it's not a scary place and it's welcome as well. And about how they dealt with their journey, their healing. And yeah, it was very personal and very touching, so I can't wait to share that with everyone. Thank you. All right. Are you doing that?
Hi, I'm Amy. I work for Cancer Services. So Trish touched on this a little bit before, but just a little bit more on the Cancer Journey Diary. This was actually Waminda's idea. Whenever Waminda support an Aboriginal person who has cancer, first thing they do is go down the shop and buy them a diary so that they can keep all of their appointments and information in one place. So that was one of our first ideas for the project. And as Trish mentioned, it's not a one-stop shop for cancer-related information. It's going to have a little bit about what the cancer journey looks like, but because all of the clinical information is provided when a patient goes through the services, but it is going to focus on the local support services offered by all the different Aboriginal organisations in the region, as well as by the Cancer Centre. And then, just as Trish mentioned, be a place people can keep all their key contacts. And it also features the stories of some Aboriginal patients who've come through the centre as well. The education program, the purpose of it is to give Aboriginal health workers and community leaders the knowledge to support their community members with cancer. We considered a lot of formats for the education program. One of them we thought about was a web-based program, but in the end, what we came back to was to keep it simple. So what we've developed is a 1-hour, it's like an orientation to the cancer journey that we're going to be holding. We want to keep it's going to sort of take the group through what the cancer journey looks like, have a tour of the cancer centre, have a patient with lived experience there to talk about their journey. And then what we're planning to do is hold that session probably annually from here on, so that when new workers come into the area, people who haven't been through or ever been in the cancer centre, for them to just come and become familiar with the people and the journey as well. Cancer support hubs. One of the first things we noticed when we started doing this project and talking to the different Aboriginal community organisations was that, like in many parts of the health sector, services were fragmented. So different services, different organisations had a really clear idea of how they supported their patients, but not a lot of knowledge necessarily about even what other Aboriginal organisations were doing in the same region. So what we've tried to do through the reference group that Trish described, and also through this support hub strategy, is bring all of those sort of services and offerings together. And we're doing a poster, and we're going to have little information hubs at Waminda, at the South Coast Medical Service, and in the Cancer Centre as well, which will have information from different services in the community, not just that organisation's information. And the data analysis. We analysed our cancer services patients, our cohort of patients who are Aboriginal, who've been with us from 2010 to 2016. And what we wanted to do was identify local trends for our own patient group and compare that with trends for Australia-wide. And I'll just... we're actually developing a poster and a separate presentation on this, but I'll just... and we don't have time really to cover a lot here, but I'll just tell you about a couple of interesting findings. So what we did find was that the most common cancers in our Aboriginal group of patients were breast, lung and lymphoma or leukemia, as compared to lung, breast and prostate for the rest of Australia. And we had another interesting finding, which we're not really sure why, but the gender distribution for lung and colorectal cancer patients was opposite to both non-Aboriginal patients as well as national data on Aboriginal patients in our service. So you can see there for, that's for lung cancer there, 60% of Aboriginal patients with lung cancer were women, whereas that's opposite in the non-Aboriginal population, and we're not really sure why that is, but the first step often to finding out why, you need to know that it's actually there. So that's what we're looking into now. And finally, I want to talk about the partnership between our two organisations, because that is actually the most important part of this work from our perspective, and because that gives us the capacity to do things for the community in the longer term. From our perspective in cancer services, we want to make our services more culturally appropriate and welcoming for Aboriginal people, and from that perspective our partnership with Wominda is absolutely vital. We couldn't do a project like this or even conceive of it without our partnership. We respect and trust the staff of Wominda as well as their organisation, because of their passionate commitment to serving their community and improving outcomes for Aboriginal people.
And it's also great as well working in partnership. Not only is Amy also learning about the Indigenous and the cultural side of things, what I'm taking into the service, I'm also learning a lot as well, getting that taste of working in mainstream as well. Have worked at an Aboriginal Women's Health Service for the last 6 years, so that's kind of all I've known since being young and working. So it's been quite good, and a lot of community are talking about it as well, having a local girl doing this project as well, knowing the people, so it's been really heart-touching as well, and I can't wait to, sadly it's finishing soon, so the project, so it's been a great experience, it has. Thank you. Thank you.
Thank you, Trish and Amy. That work looks fantastic. We really anticipate seeing the video. Did you say another week or two?
We're getting the first draft next week.
Oh, fantastic.
We need to show the community first anyway, though. So.
Trish, you talked about the reference groups that you've got. How did you identify the people that you thought were ideal to be on those? Did you go to particularly elders or certain people in the community? What was the process?
So that kind of started before I jumped on the project, but so they're there's about 4 organisations. So, and health services as well. So they're the main medical services in Nowra. So Grand Pacific Health, the hospital, the cancer centre. So I think we kind of just sent our expression to them, and then they jumped on board. So it was either their chronic care worker or someone in the health field as well. Yeah.
Great. Yes. Got a microphone coming.
Hello, my name's Julie, and I'm a survivor of head and neck cancer. And I just want to congratulate you on this project. Like, as someone who's had the terrible shock of a diagnosis, and you realise you don't know anything, and I've developed the view that unless you see things, for example, we had a quick glimpse of the radiation machine and someone lying on it. Unless you've seen it, you just cannot comprehend what you're in for. And to think that it's local people talking, obviously it's a very sophisticated program, but that wonderful imagery, I just want to congratulate you.
Thank you.
Thank you both.
Thank you. Thank you.